Hi, this is Dr. Don Bonner, and today I'm going to have to do my usual Thursday broadcast. I'm going to do it a little bit earlier. I've had kind of some scheduling conflicts today, so I apologize. Um, if anybody's expecting this later in the afternoon, like I normally put it on, and but I had a late start this morning, and then I've got some appointments this afternoon. So anyway, I just had a short talk that I wanted to do today, and I wanted to talk about. What I call the Hormone Symphony, which essentially means how all of your hormones in your body work together and in a systems approach. And I think one of the things that we find, especially when you go through the board certification and the fellowship program at the American Academy of Anti-Aging Medicine, is just really how complicated this whole system is as far as hormone management and wellness medicine, functional medicine, integrative medicine, whatever you want to call it. And it's like it's almost like an onion. There's many layers that you have to learn along the way because you change one aspect of a patient's physiology, and then there's something else that you have to change. I've got to say I'm not dressed this morning in scrubs or anything, and I just worked out. So I think a lot of you know, anybody that knows me knows I'm a big believer. We haven't really had a talk on exercise, but I'm a big believer in high intensity interval training. So I typically do that on an elliptical machine, and then I also do weightlifting for resistance exercising to maintain muscle mass. Again, big believer in muscle mass. We'll talk about that sometime in the future. And then I also do Brazilian Jiu Jitsu, and mainly it's a great exercise, and it's just fun. It's a lot of fun. So I think that if you can incorporate something in your workout routine that you enjoy, that's fun for you, and that doesn't really seem like working out, makes a huge difference, especially as you get older, because some of this, quite frankly, gets a bit boring. But anyway, that's enough about exercise. Back to the hormone symphony. Like I said, I think the thing that you find is, and what I want to do today is I want to present two separate patients, and these are hypothetical patients, but I want to present two different patients and kind of give you an idea of the complexity involved with this systems approach to taking care of patients. Uh, I think most of us were trained in the what's called basically acute care medicine, and what we do. We look for a diagnosis. We look for the problem. We make that diagnosis, and then we provide a treatment. And typically, that's a pharmaceutical treatment. And the problem that we really run into is that all of these systems work together and balance each other. And that's basically what I'm going to talk about today is how you can look at all of these systems and kind of put together a plan that encompasses everything that's going on with your particular patients. So let's. I'm going to go over to the slideshow. Quickly go through that first part of the slideshow that I always do, and then we'll get to the heart of this talk, and and let y'all get about your day. All right, let's see. Go here. Okay. All right. That's me again. We've already gone through that. Everybody knows who I am. Quick biography. Anybody that has never watched any of my videos. I'm an osteopathic physician. I went to Kirksville College of Osteopathic Medicine from 1987 to 1991. I graduated in 91. I did a rotating internship in Iowa from 1991 to 1992, and applied for residency programs in anesthesiology, was accepted at the University of Mississippi, and did a residency program there from 1992 to 95. When I finished in 95, I became board certified, and I've been in private practice in the Jackson, Mississippi metro area since 1995. During that time, and I don't exactly remember what it was probably 4 or 5 years or more ago, I became interested in this field of functional medicine, integrative medicine. So I started looking at different areas, mainly just for my own edification and education, because I knew very little about it. I found the American Academy of Anti-Aging Medicine, really enjoyed their program, and over about a year, I went through some of their introductory courses and coursework to become board certified. I passed the written boards for them, and then took oral boards and became board certified in metabolic and nutritional medicine. After I did that, they had a fellowship program, so I got into the fellowship program, and that took about 3 or 4 years to go through all 8 modules for the fellowship, and then I became a fellow in metabolic and nutritional medicine. So what I do now, I have a private practice in Ridgeland, Mississippi, and essentially I have 2 programs in my practice. I've got more of a streamlined program for patients that just want hormonal, therapy, and we do a consult on those patients, get some laboratory workup on those patients, and replace estrogen, testosterone, progesterone, thyroid, those sorts of hormones, balance those, and that's one side of the program. The other side of the program I call a metabolic reset program, and it's more all encompassing. And that's a bit more of what we're going to talk about today with the more complicated patient. What you're looking at here is I tend to reverse, what I do is I reverse engineer the mortality statistics for people older than 40, and really try to press home to my patients the importance of these, mainly these top 3 statistics here. Cardiovascular disease is by far the #1 killer for people over the age of 50 in the U.S., men and women, and I really try to drive that point home in our work that we do here in the clinic. #2 is cancer. #3 is neurodegenerative diseases such as Alzheimer's and Parkinson's disease. And accidents, by and large, are motor vehicle accidents until you become a bit older, and then falls become the #1 thing. Um, Levers to the levers that we can pull to affect your health. And again, this is a bit more with the full program that we run here at Personalized Wellness. Uh, Diet and nutrition is #1. Sleep, a close #2. Stress management, exercise resistant work, plus high intensity interval training, which we talked about a little bit earlier, and then of course hormones. And we do a lot of hormone work here at the clinic. Quick, what are hormones? They're basically just a messenger that go from one area of your body to other areas of your body to affect a change, and that's essentially what the hormones are doing. What I want to do today is I want to, like I said earlier, I want to highlight 2 basically hypothetical patients and show the difference in these types of patients, and how much needs to be accomplished and looked at to affect change. All right, patient A is a very hypothetical patient because I'm not sure I've ever seen this patient, to be honest with you. Uh, if you had a practice full of patients like this, it would be super simple, and there wouldn't be a whole lot to replacing hormones. But let's say patient A, she comes to you. I'm going to say this is a female, obviously, and she has really no problems at all. She has plenty of energy. She wakes up in the morning. She hops out of bed. She gets her day started. She doesn't take any medication on a regular basis. She sleeps very well, no insomnia whatsoever. She has no stress in her life, and she's normal weight, doesn't have any problems with weight issues at all. She is menopausal and she's looking for hormone replacement therapy. She works out. She follows a low carbohydrate diet. She's also gluten free. So, wow. So this patient, she comes in, you get some lab work, and you check her hormones out. Sure enough, she's menopausal, and her follicle stimulating hormone is elevated, and her testosterone is low. So pretty simple. You put her on some estrogen therapy, some testosterone therapy. You give her some progesterone uh, by mouth at night. You balance her hormones. You recheck her lab, and she feels great. She's having no problems. And wow, easy patient. Um, like I said, this is a very fictional patient because I don't think I've ever seen this patient. Let's move on. Let's look at patient B. These are the patients that we normally see, and the problem is as we get older, things just our hormones, like I said earlier, are a symphony, and it becomes much more than just one hormonal system or one problem that begin to drag us down. What I like to tell my patients is I look at stress as being multifactorial, and most of us think of emotional stress as really the main stress that we consider. And but I look at everything that we talked about before with those levers of health, as far as diet, nutrition, sleep, exercise, your hormones. All of those things can contribute to your stress response, including emotional stress. So typically, what I see with patients is that they do well for a period of time. Everybody's a bit different genetically. Everybody's a bit different on their lifestyle and what they do with their lives. But at some point, the stresses reach a tipping point, and then once that stress reaches a tipping point, then patients begin to have issues, and that's when they start seeking medical help and medical care, and they get into this system where they begin being treated one system at a time. So your presenting problem when this happens may be you start having some anxiety, you're a little melancholy, you don't feel like yourself, you go to the doctor, they do some lab work, everything looks fine on paper, and you may be placed on a antidepressant or an SSRI. So that's very common for me to see many patients on SSRIs. Um, you may start having some gastrointestinal problems. You have some reflux, you have chronic constipation, and you go into your physician, you're referred to a gastroenterologist, they check you out, they do endoscopy work, and everything looks great, and you're told you have irritable bowel syndrome. So now you've got another diagnosis. Um, Fatigue is very, very common. I would say 80-90% of the people that I see have fatigue, and it's a daily problem for them. Sleep, again, big problem. So, sleep, all of these. So what I'm getting at, when patients come to see you, it's not like patient A, where you've got one hormonal system that's out of whack, and you do some lab work. It's easy to treat. You give them those hormones, and everything's back to normal. What I see much more frequently is patient B, and what you have to do with that particular patient is you really have to have a full encompassing program to start to address all of these issues because they're all interrelated to some degree. And that comes from looking at the basics, understanding diet, nutrition, and what is happening to patients as they get older. And a lot of it is hormonal issues. Um, weight and weight problems. I really believe are a hormonal issue by and large, and I've talked about that in the past. And that's the program that I run, here at the clinic. um, I don't believe in calories in and calories out. I believe it's that this weight issue is a hormonal issue, and that's how we address it here at the clinic. I generally use mostly a low carbohydrate diet and then fasting protocols. It's not medication. You can use medication to help with certain symptoms when you're going about this problem with diet and nutrition. But by and large, it again is lifestyle changes. Um, Thyroid problems very very common in most all of my patients. We check multiple thyroid tests on our patients. We check a TSH level, we check a total T4, a free T3, a reverse T3, and we also checked for TPO antibodies to make sure our patients don't have Hashimoto's. So we put all those together to establish whether or not the patient has thyroid issues. And again, it's very very common for patients to have those problems. So insulin's a big problem, thyroid's a big problem, cortisol a big problem. Cortisol is a major, major hormone, and all of these stressors affect cortisol and cortisol release. And again, it's just another avenue that we have to look at and to address with the cortisol issues. Sex hormones, we've gone over those in the past. Again, that's part of the routine that we have to look at. But as you can see, there's so many things involved with these patients and so many different things that you have to look at. Gastrointestinal complaints are a big issue, and I think that especially lab testing, looking for parasites, looking for different kinds of bacteria, um, candida, all of those things are very, very prevalent. I see parasites, a fair amount in my patients. So you have to test for that. Small intestinal bacterial overgrowth, again, very, very common, and and a big, uh, very common to cause reflux and these irritable bowel syndrome type symptoms that patients have. But again, you don't know until you test for it. You have to be able to do those tests, and typically we do a breath test for small intestinal bacterial overgrowth. And then treatment's not easy for these types of things. So as you can see, all of this becomes very complicated in figuring out how to take care of these patients, and it's just not a simple process to put all of this together. Um, to a degree, maybe life would be easier just having patient A, but patient B can be very fulfilling in its, and rewarding in itself, in that you really can make a big change in people's lives by putting all these things together and addressing all these different issues. But again, that's what we do here at the clinic. Um, we're located in Ridgeland, Mississippi. We're off Highway 51. It's actually 573 Highway 51, and we're Suite D. We're on the second floor of a fourplex, an office fourplex. There's two big bright yellow Adirondack chairs out on my patio. Excuse me. And that's how a lot of people are able to find us, to be quite honest. The phone number at the clinic is 601-898-0911. The website is www.thewelldoc.com. Check that out. I'm redoing the website a bit, but you can look at the blog posts, and there's quite a few blogs on there with videos. You can go to my business page on Facebook and Personalized Wellness. Again, I have quite a few videos on there. I think 20 plus videos, and basically they just kind of go over my philosophy, what I do, what I'm looking at with patients, and what we do here at the clinic. But all right, let's go back to. We're going to turn this off. We're back on here. How's everybody doing? And let's see. Everything looks great. I don't see any questions at this particular time. I will take this presentation. I'll tape it, and I'll put it up on my timeline and on my business page at Personalized Wellness. And again, you really what I was trying to do today is just show that that there's a lot more to this than just running some lab work and checking to see what your hormone levels are and then replacing those hormones. Patients are going to get better, but if you don't address some of these underlying issues, they're uh, they're not going to get completely well just by replacing your hormones. So if I have a a 48-year-old male who comes to see me who's has a BMI of 35, so he's overweight. He doesn't eat well at all. He eats fast food frequently. He never exercises. He's hypertensive. He's got reflux. When I check that patient's hormone levels, almost certainly his testosterone is going to be low. Um, but also, if I dug deeper, his fasting glucose is probably elevated. His fasting insulin's probably elevated. His thyroid's probably low. Um, so he's got multiple GI issues. He's got reflux. I mean, there's just a number of things that patient almost assuredly will have. Now, if I replace his testosterone, he will feel better. His insulin sensitivity will increase, and all of those are positive, outcomes. But for this patient to become really well, all of those other hormones and issues have to be addressed, and that's what we strive to do here at the clinic. I do have two separate programs, but I'll be honest with you, what I really try to do, even for patients who don't want to talk about diet and nutrition, don't want to talk about sleep, they just want hormones. We'll put them in that program. We'll do a consult, but I will slowly, maybe on a subconscious level, really start talking to them about other modes of their health and their eating habits, their sleep, and really start to have them think about these other issues that we can affect some change with. Uh, all right, well, that may be a little long-winded, talk about what we do here, but I really think we make a difference, or at least we try to, and as opposed to just like I said, running some tests and giving you hormones and seeing you back in a few months and repeating the process. We try to be a bit more than that. The other thing that we really try to do, I mean, I understand your healthcare dollars, are important, and where you go to spend that money is important. And one of the things that we really strive for at at my clinic is is I understand your time's just as important as my time is. So I never double book. I never have patients scheduled at the same time. Our goal is to basically never have anybody sitting in the waiting room. I would dearly love for my furniture in the waiting room to never be used, and that's really kind of our goal. This is a service for you also. So if your appointment's at 2 o'clock, I want you to be able to go back to the office at 2 for us to start our consult or whatever it is that we're doing that particular day. And so we strive for that, and we really put a emphasis on customer service. And again, you see me. This is a physician-run clinic, and I'm board certified in this particular modality, and I strive to provide the best care that I possibly can for you. But anyway, again, that's long-winded, and I apologize for having to put this together this morning. I hope you all have a good day, and I'll I'll download this and put it on the site, and it'll run for several days, so you can come back and see it at a later time. Again, have a great day, and Dr. Don Bonner with Personalized Wellness. Thank you.